Good afternoon, and thank you for tuning in for Chamber Live and Facebook Live. I am Alice Barfield, Senior Vice President of Princeton Mercer Regional Chamber, and I am pleased to have as my guest today Debbie Millar, RN, and the Director of Community Wellness and Engagement at Penn Medicine Princeton Health, and Craig Harley, Health Educator, Community Wellness at Penn Medicine Princeton Health. Both Debbie and Craig, since March when the COVID-19 pandemic reached our community, have overseen planning and implementation of health screenings required for all staff, patients, and visitors before they enter Princeton Medical Center and other Princeton Health locations. They have screened over 2,000 individuals per day, and over the course of a month, over 60,000 individuals. Debbie and Craig will be discussing today what is necessary to keep your employees and the community healthy as we reopen for business and the programs available through the hospital. Please be sure to ask your questions in the comments section, as Debbie and Craig will be answering your questions later in the broadcast. It is now my pleasure to hand it over to this afternoon's speaker, Debbie Millar and Craig Harley.
Hi, good evening, or good afternoon, I should say.
You're getting ahead of yourself.
I am. It's that Mercury in retrograde, I heard.
Yes, I agree.
So today we're going to talk to you a little bit about screenings. When is the right time for your employees to come back into the workforce? How do you keep everyone safe? And a little bit about what we've been doing here at Princeton Medical Center and at some offsite locations, and what we could potentially provide for you as well. So when should your employees return to work? The majority of the workforce could really work home and remotely, and I'm sure most of you have been for a period of time. And research and studies that have been recently done show about 42% of the workforce still is able to provide some sort of support to their institution at home. When you are looking to come back after the pandemic and begin your workforce back into normal functions is when you really need to start to think about what you're going to do to have keep your employees safe, to keep people that come into your facility safe, and what you need to have in place post-pandemic. So what the World Health Organization really recommends that for non-essential workers, to have them stay at home, to really decrease the percentage of people coming up with COVID-19 or any type of disease transmission in the community. It really decreases the positive test results, and until significant testing is available, and until we can come up with some sort of cure or some sort of vaccine or some sort of really anything that's going to tell us that once we've had the vaccine or had the disease, that reinfection is not going to occur. So who should return to the workplace? That will be up to you and your facility to determine who you need to have come in, who needs to be essential, who needs to be there, who you really need to make sure that is in the actual workplace working in the facility, and then those that you need to be able to furlough or be able to work at home. So not everyone all at once should reemerge, and it's best to really bring them back in gradually. So here at the hospital, we're considered essential workers. Yeah. So we needed to have most of our staff here. Some of the staff that was non-essential, we did furlough or have them work in other departments. So we didn't necessarily have to bring back anyone, have them stay at home and work from home, but some non-essential workers are. And when we bring people into the facility, my colleague Craig and I, for the last 17 weeks now, he said?
18 weeks starting Thursday.
18 weeks starting Thursday. We have put together the screening process here at the facility. So, Craig, I don't know if you want to talk a little bit about who we screen and how we screen.
Absolutely. I mean, when we started the process, and we started this all back the second week of March, and really picked it up a couple of notches the third week of March when we were required to do our screening, mask and everything else. And, I've taken a bit of an assistant role for Debbie on the weekends and such. And we started with our employees, of course, because during this time period, we have not been authorized to have visitors, very limited on visitors and what we can and can't do. But everybody entering our facility is screened. And we use a screening format and it's questions. We also do the temperature check. But we certainly have learned, if I may, over these 17 plus weeks is that, temperature is not the only thing that we need to be aware of. We need to talk to the folks, and we need to do these screenings. And people that are on the front lines who are living this every day, we kind of got an idea of what to do and what not to do. We're constantly up to date on the CDC guidelines, rules, regulations, protocols, and such. But not everybody is. Even maybe people that work in the healthcare industry are 100% on what they can and can't do. And what we found is that when we speak to folks and when we do the screening process, in a lot of cases, we are actually educating. And that's all important. The folks that maybe they did come in contact with or were exposed to without really even realizing that they were. And then we were able to help them to do what they needed to do in order to get themselves well or make sure that they were well and self-isolate and so on and so forth. So, it's been very much for us a learning experience for certain. And, being in it as much as we have, we've learned quite a deal.
Yeah. So if you're looking to bring people back into your facilities and trying to figure out who you need to maybe have home and stay at home, really it's really suggested that the people that are at higher risk for infection, those over 60, those are who are at risk for chronic lung disease or heart disease, diabetes, or kidney disease, really remain remote as much as possible. And then maybe any of the other employees that do not be considered at risk, maybe the ones that you might want to bring back into your facility because they pose a less risk for exposure. So to protect our employees from work, what you'd want to do is, like Craig had mentioned, the thermoscans and the screening questions information. Every person that enters our facility, we have them go through a questionnaire. The questionnaire really only takes, I would say, maybe 15 seconds, 20 seconds a person, really. Yeah. And we really find that the clinical view, someone really looking at them, talking with them, asking them the questions, like Craig had said, making them understand what those questions mean, really kind of gets to the heart of whether or not that they should really be in the facility. So we follow the CDC guidelines. So we ask, have you ever, how are you feeling today? Do you have any fever, flu-like symptoms, cough, runny nose, sore throat, shortness of breath, any GI disturbances, any congestion, any of the CDC recommendations of questions that you need to ask? And if they are really experiencing any of those symptoms, so we say anyone that you live with or any family members, or anybody that you've been exposed to experiencing any of those symptoms. And then from there, have any of them or anyone else been exposed? Has anybody else have any testing that was done? Anyone tested for COVID? And then from there, we kind of determine what their temperature is with the thermoscan, and then that determines whether or not they enter the facility. We can say that out of everyone here that we have come into the facility, a good 98% of them, that if we have to say they cannot enter the facility, has nothing to do with the temperature. It's more so the questions and the risk factors that they pose for who they've been exposed to.
And I may also add that back and during that time frame, our the highest temperature we would allow in was 100.1. We've now lowered that to 99.0, and that's for our staff, not so much our patients. But again, to Debbie's point, a very small percentage of the folks who were excused was because of that high temperature, and more so the questions, and again, that educational component for the most part, I believe.
Yeah.
And if I may, on a personal note too, one of the things, and I'm sure most of us have dealt with this. I mean, we just went through a pandemic. We're in a pandemic. In the beginning, there was a lot of stress, and we had to make sure that we were we were using that personal touch and being understanding and almost being like psychologists in a lot of ways to the folks that we were dealing with. Not only our patients, but our staff as well, because we were all going through extremely stressful times, and we still are. Over the last couple of months, it's kind of become the norm, and things kind of settled. But now that we are starting to see our reopenings, everything from our hospitals to our government entities, our restaurants, so on and so forth, we're seeing that stress level again spike. And I think it's important that we realize, especially us folks that are on the front lines that are dealing with our staff and seeing our staff and screening our staff or whatever we're doing, that we are aware of that and know that there's still a high level of stress out there. And again, as far as my personal opinion goes on this and what we're doing here, I'm seeing that high level of stress, both with our patients as well as our employees, again, kind of go up a little bit. And that's certainly understandable. I mean, we went from being almost isolated for a good 4 months to now trying to get back to some normalcy. And I think we all need to be conscious of that.
Yeah, I agree. And that kind of brings up a good point. And one of the programs that we offer here at Penn Medicine Princeton Health is a mental health first aid course. Mm-hmm. And it's a great course to have for your employees. We've done it for several corporations and businesses, small or large. And we could either do it online or we could do it in person. In person, of course, would be social distancing, people 6 feet apart and wearing masks and being screened before they come into the course. But it is a course that offers your employees the understanding of different mental health disorders, mental health illnesses, and how to recognize them, not only in themselves, but in some of their colleagues. And if they see that, what do they do to help them? What do they ask? How do they approach them? Who do they refer them to? And we do that, again, virtually or in person. And it actually comes with a 3-year certification. So your staff members will be certified in mental health first aid for 3 years.
And it's a great program, too.
Mm-hmm.
I think in the beginning, when I became an instructor for that program, I kind of struggled with the title. Mental health first aid, what was that? And then after going through the instructor's course and teaching the course a few times, it finally kind of came to me. I mean, we are not becoming therapists within this week-long course. What we're becoming, if you've ever taken a CPR class, if you've ever taken a first aid class, we're becoming that person on the street who sees somebody who may need that CPR, who may need that first aid. And we are able to offer that immediate help and then get them to a higher medical authority. The mental health first aid course kind of is similar to that in that not necessarily are we dealing with a cut where we're putting that Band-Aid on it until it can get stitches, but we're helping that person that may have that mental health issue until they can get that higher medical authority that can give them the appropriate help necessary to possibly, help them cope. And coping mechanisms are a big thing within that program as well. Learning to cope, knowing how to cope, and giving advice on how to cope. So it's a good program.
Yeah, a very good program. And right along the same lines there with the mental health first aid for your employees, what else can we do to help protect our staff? Yeah. And to help protect them, we did mention social distancing. So if you start to have your employees come back, you really need to take a look at your facility, make sure that everything is cleaned and wiped down several times throughout the day. Make sure that people are social distancing and that you have maybe office spaces or desks 6 feet apart. If you have elevators where your staff needs to go into, the best way to do that is to have maybe 410 elevator, depending on the size of the elevator, and then have them so their backs are facing when they come in. So they will face different directions.
Sure.
That way we're not, again, 6 feet in the elevator, but they're facing different directions.
And it's important that we're constantly cleaning too. I mean, we clean a lot. I know I've learned a lot of good cleaning habits in the last 4 months, as well as a lot of other people, but we're just constantly cleaning. And, I have to say, when we are dealing with the public or when we are dealing with our clients or whatever the case may be, and I don't mean this to sound, for lack of a better term, improper, but perceptionally, when we have the public coming into our facilities and you have staff that are actively cleaning and they're taking care of those door handles, those doorknobs, they're taking care of those countertops, and they're keeping, up on things and keeping things clean. When we as the public see that, we as clients see that, then it gives us more of a sense of security too. Whereas we might have been a little bit nervous about going in and what has been touched last. I know a lot of people are having complaints about glove use. The gloves being used by people just to maybe handle credit cards or whatever the case may be. Well, they may have handled 100 credit cards. Does that protect me when I give my credit card to that person? No, it doesn't. It protects that person. But if I see that person actively cleaning there, it's going to make me feel a little bit better. If I see that person changing out those gloves and putting on new gloves each and every time they use them, it's going to make me feel a little bit better. Not only is it clean, is it safe practices, but perceptually, that's good for our clientele.
Yeah, so you do want to make sure that you clean often and frequently. Yes,
I guess that's the moral of that story.
Yeah,
yes.
it is. So again, what else we can do is make sure that people wear masks. So you have a cloth mask or you have the surgical masks or the N95 mask or whatever mask that they're doing, some sort of facial barrier device. And with the barrier devices on the face, it's very important that they fit correctly. You will see some people coming out that are wearing masks that are underneath their nose. That's not protecting them or you. You want to make sure that it fits nice and tight and secure around the face here, around the side of the face and underneath the neck as well. So you need to make sure that their barrier devices are fitting properly and corrective. So we have the face mask, we have the social distancing, you have the cleaning, you would have the thermoscan temperatures, you would have the screening tool that they have before they can even come into the facility.
Yeah. And again, I can't say enough about it with regards to the cleaning and perception. I know that for me, and I'm not, this is just me. I probably have felt safer coming into the hospital and working when I do and helping when I do than really more comfortable with that than going into a grocery store. Now, I know they are frontline workers too, just like we are. They're out there, they're risking their own health. And they're providing for us, and I get all that. But it's just the volume of people that are in the grocery stores and maybe not being as protected as what I'm seeing here at the hospital. I'm more comfortable coming here than there. Now, that's starting to ease up a little bit. I'm starting to see a lot better practices by the public and feeling a little bit better than that. But the point being is, again, that perception there. I'm seeing the PPE used. I'm seeing it used properly here. And we all need to pitch in and do that. So we're all comfortable and we're all safe. And the other thing with the mask, if it's got the metal bar in the nose area, make sure you pinch it in to keep it tight against the nose.
Yeah, absolutely. Now, I know we're looking at the time. We're kind of done with the time frame of where we should be talking to ask some questions. So does anyone have any questions? We can go a little deeper into some of this information. But.
Great. Yeah. Thank you. Thank you, Debbie and Craig. We've got a question from Princeton Vicky. Can you share some of the screening questions you use?
Sure, absolutely. It's kind of what I had said when we said before. So as someone comes into our facility, the first thing that we ask them is, how are you feeling today? We greet them, of course. And then we ask them, are they experiencing any of the COVID-like symptoms that are recommended by the CDC? So that is, have you had a fever within the last 72 hours? Do you feel ill? Do you have a cough, a fever, sore throat, shortness of breath, congestion, GI disturbances such as diarrhea or stomach pains, nausea, those sorts of things? And then from there, we go into, have they been exposed to anyone that is experiencing those symptoms? Have they been exposed to anyone that they know has been tested positive for COVID? Have they been tested themselves for COVID? And then if so, we find out yes or no, and then we kind of go into a little bit more from there. And then we have an entire flow chart that we follow that if they answer yes to any of those questions, then it kind of leads us to other questions, and then whether or not they're safe for themselves or for anyone in the facility to come in.
Would they be able to find these questions listed on the CDC site, for instance?
Some of those, yes. Yes. Our questionnaire here at the hospital, we met with, obviously we follow CDC guidelines. We've also, our medical director for the hospital and our medical director for the emergency room, as well as for occupational medicine, as well as our chief nursing officer, we all came together. We looked at those questions, and we're actually on version 5. So as things kind of transition through the pandemic, those questions change in relation to what's happening.
All right. So we have to take in consideration right now, what Connecticut, New York, and New Jersey is doing with regards to the states that have the higher ones and coming in and having to quarantine for the 14 days. And we've also just, the CDC finally updated to show that GI issues are another thing we need to look for when we're looking for, possible symptoms of the COVID.
Great. We've got another question here. How can our audience find out about your program for mental health training and coaching?
Sure, certainly. So you can reach out to us here at the hospital, myself or Craig. So we can, I'm assuming else we can somehow get them our information out to everyone. Or you can go onto our website, which is the community, www.princetonhcs.org, and then /calendar, and you can find the mental health first aid courses there. Or if you want one separately for your organization, just reach out to myself, and I believe my information is listed on the website.
That would be great. And Debbie, if you provide us that link, we'll post it in the comments here, and then everybody will be able to see it.
Absolutely.
And next question: how long does the screening process typically take?
Well, that's a great question. It's pretty quick. I mean, a learning curve definitely in the beginning. How many staff to have at certain places at certain times, the different rush hours and things of that nature. But we've actually looked at that and looked at it pretty closely, and it's really between about 12 and 15 seconds, barring no issues. So 12 or 15 seconds to go through that screening, that questionnaire that we use, temperature check, and then have a nice day. If there are any issues, then we have other protocols that we follow, and we deal with that accordingly. But it's pretty quick, and we get through, like you said, we're doing about 2,000 employees a day on average, 60,000-ish a month. It's a lot of people between employees and staff and guests. So we have to be quick. We have to be accurate, but we have to be quick.
You mentioned the thermoscan technology. How important is that? That it be used in conjunction with the questions asked of somebody.
So in other words, so I understand you correctly, in other words, how important is taking a temperature along with the questions?
Yeah.
Okay.
Yes.
To make sure I understood you correctly.
Thank you. Yeah.
Yeah. So, I mean, it's important to kind of do them together. You wouldn't necessarily want to have one without the other. It's kind of the entire screening process. It's part of the evaluation.
Yeah.
Okay. Great. We've got another question here. Should both employees and visitors be screened?
Yes, anyone entering your facility should be screened. That way you're keeping both your staff, your visitors, and all of you safe at the same time.
Okay, terrific. Well, it looks as though that may be it for our questions. Oh, we've got another one that just came in. What is your opinion on the LED lighting installed into your company?
We're just getting some research on the LED lighting, and I've heard mixed reviews. I don't have accurate information to be able to guide you one direction or the other to say at this point in time whether it's good or not good to use. I know some facilities are, I know some facilities aren't. So it really depends on, the research that's coming out about it right now. Yeah, so unfortunately I don't have a direct answer for that.
Yeah, we're doing the same thing ourselves and doing that research, and we don't want to rule anything out, but we want to be well informed.
So more to come on that. We'll have to keep our eyes open.
Correct. Yeah, with the pandemic, this is obviously new for all of us. We haven't seen anything like this in 100 years. So it's all a learning experience for all of us.
Yeah. Certainly is. No doubt about that. Well, thank you, Debbie and Craig, for taking time out of your busy day to share your expertise with our audience on how to safely enter back to work. We very much appreciate your being with us today. I'd also like to thank our production sponsor, April Setti and NJ Buzz Productions. If you're not familiar with New Jersey Buzz, I highly recommend you follow them on Facebook. Thank you all for tuning in today. I do hope you will join us again on Tuesday, July 15th at 12:30 for our next Chamber Live broadcast. Have a great day, everyone. Be safe and please stay well. Thank you.
Thank you.